Hey, hi, and welcome everybody to the legislative update on this May 12th, 2017, presented by Dave Fear Jr. of Shepler and Fear General Agency. It has been a busy end to the week, and I'm very happy to say that it's over. We'll get into all the fun details that goes with that. But before we do, I just want to give a reminder that the Shepler Fear General Agency has been very involved over the last 25 years in all things legislative action. As you see, we're members of the Association of Health Underwriters, as well as the Self-Insurance Institute of America, the Coalition for Business Healthcare Choices. We play a big role in the legislative affairs for the different groups. And between Senior and myself and our past partner, founding partner, Rob Shepler, there was a lot of work that was done legislatively. This is kind of what we like to do. So let's get into it. The big thing that everybody cares about in the state of California at the moment is SB 562. This is the single-payer government-run health plan that is being proposed in the California State Senate. It went to its first committee on May 2nd, and I was there to testify against the bill, along with a handful of other members of the Association of Health Underwriters. We were outnumbered by folks in red shirts who were mainly members of nurses unions by roughly 100 to 1 probably. There was over 1,000 of them there for the meeting, but they only let about 300 in the room, and the rest had to go back to the convention center and watch the feed through the TV. And so that was interesting, to say the least. There was great testimony given against the bill by the California Chamber of Commerce, who said essentially this and labeled it as a job killer. There was also the California Health Plans, who said this is going to be a huge cost, way more than anything you're saying. And the really interesting one was the lobbyist for, or I'm not sure she was the lobbyist or not, but she represented Kaiser Permanente. And she was there to testify that this system that is being proposed would indeed put them out of business. And that was interesting because a large part of the nurses in that room were Kaiser employees. And the proponents of the bill tried many different ways to get Kaiser to come off of their stance and say, yes, we can work with this, okay, we can figure something out. And Kaiser did not take that bait. They said, you don't understand how we work. What you're proposing here would work fine for Sutter or would work fine for one of these other companies, but it would put us out of business. And you saw the crowd get a little less energetic when that point kept getting driven home. It did pass out of committee on a 5-2 vote with 2 Democrats abstaining voting and the Republicans voting against it. And that outcome was known before we even went into it. Now, of course, a very interesting fact is they still have not put any financing issues with the bill. Anytime it was questioned in that first committee, it was basically said, we're working on it, we'll provide that soon. And as of right now, they're saying that the financing aspect of this is supposed to come out on May 25th. The bill is next scheduled to go to the appropriations, which is typically the committee that deals with the finance issues. So you would think that's where this bill is going to die. The second they put how much it's going to cost, that committee is going to say no chance in heck, and there it goes. However, the head of the Appropriations Committee for the Senate is one of the authors of the bill, Senator Ricardo Lara. So we are expecting that whether or not they do get that promised financing attached to the bill in time or not, that it will make it out of that committee as well. So we do expect it to go to the Senate floor for a vote, and at which point it's possible it could go away or die there. But to be honest, right now what's happening is all political and theater. A lot of the votes and actions that are being taken of the, and I'm using quotation marks here, supporters of this bill, is being done more for the theatrics of it and making sure that the supporters of the bill feel like they are on the same page as the legislatures. In all actuality, this bill probably will make it to the Assembly, and our hopes is that it will die somewhere on that side, probably in the Appropriations Committee. I'll get into it a little bit more on my next in a couple of slides with some of the visits that we had CAHU leadership with the leadership of both the Assembly and Senate and what they told me about SB 562. And I'll hold on to that for just a moment, but I do want to talk about that last bullet point. So CAHU funded a survey. It cost us about $25,000, and they went out at the end of April, and they did a sampling of more than 1,000 different likely voters. And these voters were asked a variety of questions about single-payer, universal single-payer health coverage. And the results surprised even us as health insurance agents. And the results were presented to CAHU at our day at the Capitol on Wednesday, and then was sent out in a national press release. And I will share a little bit of what that is, but it is not near as good as what the proponents of single payer believe it is. I'm going to read to you a few of the key messages from that polling that we did. 81% of Californians are satisfied with the health care they have received in the past 3 years. They are happy with the timeliness, cost, availability, and accessibility of health care coverage for their families. 66% of Californians oppose a new proposed law establishing single-payer universal health care. Under this law, all Californians will lose their current health plan, replaced by a new government program administered by the state of California. Californians will see their annual taxes at least double. So this was interesting. For anybody who's aware of the fight that occurred in Colorado, they had a proposition on the ballot to institute a single-payer system for Coloradans. In initial polling, before anything else was added, just are you in favor of a single-payer system in the state of Colorado? There was about 60% of the folks who said, yeah, I think it would be a good idea. About 20% who said, no, it's a bad idea. And another 20% said, I'm really not sure. Once the financing and the details of what happens to your doctors and everything else was attached, that proposition ended up going down 80-20, okay? 80% against and 20% for. So it started, however, in Colorado with a 60% liking that idea. And what we found, according to our survey, is that we are currently at 60%, 66% roughly, already are not in favor of it. And then when we asked them questions such as, you know, would you be in favor of this, when we and include the tax aspect, all of a sudden that number went to about 80%, saying, no, I do not want this. When asked that you'll lose your current coverage, would you still support this? 85% said, no, I do not like this. So this survey was very interesting in finding out how, even in the dark blue state of California, how your average person does not want the government to be in charge of their health care. So that's good news on, it's good news, but it's not over yet. The battle for single payer, again, from what we have learned talking to folks behind the scenes, is that this is not, and was never expected to be passed into law this year. This particular bill will turn into a 2-year bill, which means they'll stall it somewhere, and it will be brought up again in the next section, the 2017-18 session, and they'll make a push at that point. But Speaker, the head of the Assembly for California, Rendon, has come out saying, which is what a lot of the leaders have said, is I support in concept this idea, but, you know, and then they get into the details of what the but is, and typically it is the finance aspect of it. And Governor Brown has as well expressed a similar feeling. So I don't think this is going to get far, but this is something that will be around for the next 4 years. And when I say 4 years is because in 2 years we will have a new governor. Governor Brown will be gone, and we will have someone else new in there. And all thoughts at this point are looking at Gavin Newsom. Gavin Newsom has come out and said, I'm a supporter of this. However, when he defined single payer, he used the San Francisco model, like he did obviously in his city, and that model is significantly different from single payer. So we're not sure yet, does that, when Gavin Newsom says he's a supporter of single payer, is he talking about this type of single payer, or is he kind of confusing that and looking more at his San Francisco model, which is not a single payer system, more of a mandate that everybody has coverage, and for those who don't get it elsewhere, there's a Medicaid for all type of thing, which again is significantly different than this. So while I have good news on SB 562, we as health insurance agents cannot stop beating the drum on this. My goal from the very beginning was that we would defeat this, but we would also use it as an opportunity to educate the Californians, particularly the newer generation who hasn't really heard this. They're the Bernie Sanders followers, and they think it's just a great idea on concept, but to explain to those folks why single payer is not the answer. So you will continue to receive information asking for help on fighting this concept, because it will be more than likely a 4-year battle. And we will open this up to questions afterwards, but let's go ahead and keep moving on here. The other big item was the AHCA, the American Health Care Act. This was the one that was about to be passed, and then it was killed, and then it came up again, and then it died. And you know, all the theatrics of anybody who's been watching cable news has seen the circus that is the AHCA. But it did finally pass out of the House of Representatives last week. The bill was very similar to what was originally proposed, and I would point out to you that a big win for the agents like ourselves, and this was done in main part by NAHU, the National Association of Health Underwriters, is to make sure that the employer exclusion was not included in that. For folks who don't understand what the employer exclusion is, that is what allows employers to pay for their health insurance benefits of employees and make that pre-taxed or tax deferred, I should say. So every dollar that they spend on their employees' health care, they don't have to pay as income, essentially. That's the employer exclusion. And originally, they were going to put a cap on that, saying that employers could only write off, you know, a certain dollar amount per employee, and if they do any more than that, then it's not. It's taxed as any other earnings for a business. We were successful in getting that to be not included in the version that passed out of the House of Representatives. But a big thing that will really affect us is that issue of Medicaid block funding. And this was covered in detail on at our symposium earlier in this week for CAHU. The reason why that is worrisome is that currently the state of California expanded their Medicaid, which we call Medi-Cal, to a variety of new people. And this occurred starting back in, I believe, 2014, or shoot, it might have even been before that. And since that point, I believe we have 4 million new enrollees on Medi-Cal. And the federal government, for the first several years, said basically, we'll pay for everything. Whatever it is, you just do these codes, and we'll reimburse you for it. That number dropped a little bit starting this last year, and the state of California had to figure out a way to kind of increase what they were paying towards Medicaid funding, but still the large majority of that funding, and I'm talking hundreds of billions of dollars, is coming from the federal government. And so what the proposal in the AHCA says is, okay, we're not going to just continue to pay whatever you want. We'll give you guys a block of money, and it'll be a big block of money, but here's what it is, and you guys figure out what you want to do with it. Well, those in charge of the state of California see that as an issue because it does nothing to change or to increase with the cost of care. And these are actually, I believe, 10-year blocks. So the federal government would say, okay, California, here's your number. This is all the funding you're going to get for the next 10 years for Medicaid. Bam. And whether California blows through that in 5 years or they make it last all the way out to 9.5 years, that's it. There's nothing else. And so when Californians are doing the math on that, that's where you're getting that number that you're hearing on cable news about all these people who will be losing their coverage. When they figure that out, there will be a big chunk of those 4 million people who just got added to California's Medicaid that would be then kicked off. And how would that affect the rest of what we're doing in the state of California? There are still changes to the CSR, the cost. Oh shoot, I forget it, but it's the subsidies where if you buy a plan through the state of California or covered California, rather than paying the $800, the subsidy is covering $600 and you're only paying $200. Or rather than having that $2,000 deductible, the government is buying that down so that you're only having a $500 deductible. So that will change. It will be a set dollar amount between $2,000 and $4,000 per year, depending on your age and nothing else. Many folks who are in that lower middle class, the roughly right above Medicaid or Medi-Cal level, up to about 250% of federal poverty, receive huge amounts of subsidies. If you're a 62-year-old who makes 150% of federal poverty, you're getting a $1,500 subsidy a month. And so this new one is saying, yeah, you would get up to $4,000 in a year. So obviously that's going to have a big effect on how many people are going to buy coverage or stay with their coverage. And again, that's why you're hearing the numbers in the media about how many people will lose their coverage, because ultimately they're thinking that if you're only going to give a subsidy of $4,000 per year to a 62-year-old and his insurance costs $12,000 a year, that guy's not going to continue on his coverage and rely on the ER system, or what happens when you're uninsured. So that's what came out of the House, and we talked about that before. I just wanted kind of the big issues on what would affect us here in California. However, let's not get too riled up about this. It still has to go to the Senate. The Senate has already expressed their desire to that a lot of parts of this they are not okay with. While the Senate is controlled by Republicans and they're going to use reconciliation, which means they only have to have 51% of the vote, it is still thought that what ends up passing through the Senate is going to have to change quite a bit from what it currently looks like that passed out of the House. So without going too much further into the what-ifs of how that bill is going to change, I would just recommend to you that you tell other folks, just let's wait and see. If that continues to move, the only way it's probably going to get out of the Senate is with some changes. And I wouldn't be surprised that Medicaid and the subsidies that would greatly hurt states like California don't get changed somewhat in order to get it through. So that's the AHCA, which again, a big deal that it's at least moving, but you can expect this to take some time. The Senate won't even talk about it for another probably month or so, and in order for it to get through there, I think you're talking later into the year at the earliest. And it might even be this time next year that the Senate is really doing the work on it. So the other big thing that I said this was a big legislative week was the CAHU Capitol Summit. I'm reporting on that because I just finished my third time running the whole thing as the CAHU, the Vice President of Legislation. I was kind of the head guy running it, and I had some great people working as a committee to get it all done. A couple of the quick highlights of it were we did a panel discussion on federal health care reform. We had experts, we brought in an expert from Washington, D.C., Marcy Buckner, who is the head legislative person for NAHU, Charles Bakke, who is the CEO of the California Health Plans, and then our own lobbyist, Julie Broyles, who gave us this perspective on here's what's happening in the federal health care reform, and then ultimately how each of those things will affect us here in California. And those two things that I talked about on the last screen were probably the biggest of concern, especially for the health plans and how they're currently funding things. The other big item was that the panel discussion on how to discuss single payer with all Californians. Again, we brought in an expert group of folks, Perry Communications, Neil Crosby, and Faith Lane, who gave us great insight onto, you know, what are people feeling about single payer, and is it as popular as they think? What is the polling on it? How do people like it? And how then to effectively communicate that to everyone that, look, that's great that you think it's the solution, but here's why it's not. And, you know, lots of dealing with not necessarily being fighting, but figuring out how to talk in a respectable manner so that the points as to why this isn't the solution can get across. And as you go out and talk about single payer, I would tell you that the biggest two issues on single payer that you should talk about in forums and with family and friends is the cost. The cost is going to be ginormous. And the UCLA estimate on what it would take back in 2011 to implement single payer in this state, it was $350 billion. If you're taking notes, the current California state budget is about $127 billion. Single payer just by itself would be $350 billion. Okay? And that's really as far as you need to get with a lot of folks. It's just not feasible. You're talking, and I use the example at the conference, that if you take that number, divide it by all California belly buttons that are living in the state, that's about $9,200 per person per year. For a family like mine, who wife and 5 kids, a family of 7, that equals $5,366 a month is what I would have to pay in order to make single payer work. So you're talking a full-time job, $5,300 a month to make it work. And again, I don't think any proponent of single payer can really glance at or overcome that hurdle. I'll also say that 90% of all the assembly and senators in the state of California were visited by CAHU members who discussed specific bills and why we're either for them and against them, and mainly focused on the role of the agent. That was one of the things we really wanted to drive home, is that while we're talking about specifics of SB 562 or the HSA bill or a couple of the other things that were specific, we wanted to spend more time on just the role of the agent, what we do, how we do it, and what the value is. And that, in my opinion, is a more lasting thing to do for our legislators than some of the specifics. So I think most would consider who attended that to be a great success. Very happy with it. That puts us at about 25 minutes. And that's really what I kind of wanted to do at this time, let you know that we're going to continue to provide you with updates as it happens. Obviously, if we're doing this about every month, we shouldn't need to spend, an hour each time. It's just kind of where we progressed from last time, kind of big items. And so understand that the NAHU and the CAHU are excellent organizations that do the grassroots on both, obviously, for national and the state level. As we go there and we talk with both Republicans and Democrats, we really do try to take a neutral stance on this. And it gets us in the door and it gets us to their ears. My conversation with Senator Ed Hernandez is very different than my conversation with Assembly Member Chad Mays, the leading Assembly Republican versus the head of the Democrat of the Senate Health Committee. We go in there and we say, look, we like the AHCA, let's make it work. Let's not do this dumb SB 562. Let's talk about how we can make what we have work better, versus the Republicans who we just kind of look at and say, you guys don't even have a third of all the people here. I'm just kidding. They're good guys, and we provide them with the ammunition so that they can make those arguments on the floors and in committees and sound really educated. We hope that you will continue to look at our e-blasts. We really try to limit how often we're sending them out. I get as many emails as you all do as well, and I get it. Most of the times you look at the subject line and then you delete it. We really, when you see that email coming out from Shepler and Fear, we try to only make them as are appropriate and important, and not just wasting your time. If anybody's not currently a member of NAHU and CAHU, I would very much encourage you to. You email me, I'll get you the application when we're done. And with that, okay, go backwards. I'll go ahead and finish the webinar for the day. If you can talk, you can ask me any questions if you'd like at this time. I don't hear anybody talking, which either means you're still on mute and you didn't realize it, or we did a pretty decent job of explaining what was going on today. The other thing that you can do is there's a chat bar in this GoToMeeting, and you could always type a question in there if you just don't have audio stuff working. I'm going to give it about 30 more seconds, well, 15 more seconds to see if anybody has any questions or concerns. Okay, excellent. Well, I appreciate everybody being on the call today, or actually webinar today. Feel free, if you do have any questions, things that are going on legislatively, feel free to either give me a call or email me. For those who don't have my direct email, it's super easy. It's David Fear, F like Frank, E-A-R, J-R as in junior, at sheplerfear.com. Okay, and I'll get back to you if you can. Thanks a lot. Have a great weekend, and we'll talk to you soon. Bye.